Leap to Unicorn with IDFC FIRST Bank in association with Moneycontrol and CNBC-TV18 Season 2.
Welcome back to the grand finale of Leap to Unicorn Season 2 presented by IDFC FIRST Bank in association with Moneycontrol and CNBC-TV18. The next startup we have for you is AI Health Highway India, founded by Dr. Satish S. Jeevanavar. This healthcare startup focuses on scalable health solutions with a mission to make a positive impact. Let's deep dive into their journey.
We started AI Health Highway in 2019, but all the learnings came from a previous organization and the work I have done so far in primary healthcare. So I'm a physician by background. Most of my early days of practice was in the Indian Army. I was SHO in cardiology in Narayan Rudhyalaya. So I came out of the armed forces in 2008 after serving my short service. I'm also an alumnus of IIM Bangalore. So our first startup was a chain of GP clinics where I was one of the founding team members, and both me and Ashwin worked in a US based M-Health company. So the origin actually comes from the learnings in these previous organizations where healthcare access is a big challenge in India. So we mainly focus on solving NCDs or non-communicable disorders because that's the biggest disease burden, and we lose 43 million patients every year across the globe. We kind of started working on this problem statement, and that is when we came across this idea of AI-enabled stethoscope. A stethoscope is most commonly used tool by any doctor. So if we can bring in technology and make it more accessible to primary healthcare clinics and the staff, we can tackle most of the addressing issues in cardiac and respiratory disease segment. So that is how we started with AI Health Highway journey.
As of today, we have deployed our heart algorithm in the market, and so next we will be working on the respiratory part. So heart and lung put together, like, it actually covers a huge spectrum of the public disease. So and also the moonshot would be on the prediction. So that is something like which we will be focusing on for the next 5 years to come.
So I think Leap to Unicorn was an excellent initiative. We had heard reviews about the first season and how it helped a lot of founders. So we are pretty excited or thrilled when we got selected to this initiative. It is different from other accelerators and incubators because I think that gave us access to a lot of founders who have built successful companies, especially sessions on the go-to-marketing, what kind of challenges a startup faces from the regulatory environment. And I think there were almost 15 to 20 sessions which were organized by the Leap to Unicorn team. And this helped us bring in insights from other founders who have been there, done that, how those solutions were relevant for our startup. And especially for our startup, I think the go-to-market and getting the distribution, supply chain, so these are all unique challenges for a medtech startup. So I think it gave a good flavor of these insightful sessions from key panelists who gave us insights on go-to-marketing, and the second thing was on the entire fundraise process, what are the best practices.
Next, we welcome Jinendra Bhandari, Chairman at JITO Incubation and Innovation Foundation and partner at MGB. He saw immense value in AI Health Highway's mission. He will discuss why the startup aligns with his investment philosophy.
AI Health Highway is a large impact, a small company. I think it has around 20 people, but it's a large impact company because it works on cardio, respiratory space, which is heart. And all of us in India are facing heart issues, right from the top end to the bottom end, because the type of food we eat, the kind of environment we are. There's a huge potential for somebody who can manage the heart healthcare issue. I mean, if you've seen earlier, there was surgeries, bypass surgeries were very uncommon. But now I think every third person I meet at more than 40-45 years of age is either going through angiograph or is going through a bypass surgery, and it's become very common. It's like going 7 days. Even the hospitals have a 7-day package that you come, do a 7-day package and move out. It's like a small surgery which you undergo, and we're talking about heart surgeries. So AI Health Highway is a fantastic company. What it does is it has created, it's not only a medical device company, but it also collects data and it also runs an intelligence AI platform on it. So it's not a pure device company. It has multiple layers of intelligence to it, which gives you a lot of insight to data what it collects. So I found personally somebody who's attacking a big problem, working on a very, very stealth mode, in that sense that, working very silently into that space, and which is impactful. I mean, at the end of the day, it's reducing cost to a local guy on the rural area multifold. I think it's a perfect investment thesis for our platform, where we are going to make big impact on the healthcare of millions of people and at the same time make money in it. So I think there cannot be any better way to put money in a startup which does this. So we have made them an offer of around 1 crore to invest in their companies, along with a lot of other investors who are pitching in. So it makes good sense for us, and hopefully they'll do well.